Hi everybody, am I audible and visible? Hi everyone, am I audible and visible? Good morning. So, am I audible and visible, everyone? Okay, so now we all know that INICET exam is just round the corner. Okay, so this is just a quick revision of PSM Sure short for INICET. That means over here we will be revising a couple of PYQs, okay, from all the important chapters, which will give you an overview of the entire PSM again. Okay, so this is going to be almost 1.5 hours session. All right, 1.5 hour session. We'll try to wrap it up. It has a lot of important questions. You can also access it once the session is over. Right after the class, I will share the PDF on the Telegram group. The link to the group is in the comment section, and do share with your friends and everybody so that each one of you can benefit from this session. Okay, I hope everybody is doing good. All right, we have almost 50-60 questions. So quick look at the questions, quick look at the answers, and accordingly move ahead in the session. Any doubts, any queries that you have from the Telegram quizzes which are being conducted, you can write it and ask me when we finish the session. All right. Okay, we'll see. I have a lot of slides. I have almost more than 100 slides, so we will discuss all the updates also. See, updates ka slide presentation, a YouTube session I just taken a couple of months back, so there are no major updates as of now except for the new MMR values, all that demographic that also has been shared, but at the end I will tell you that also. So without taking a lot of your time, let's start. So this is the first question that you can see over here. Match the following scientists with their discoveries. So yeah, you might think that this was asked in the INICET exams. This was asked in the INICET exams. Scientists with their discoveries. So let us try to match the following. The scientists with their discoveries, everybody. James Lind. Now there's something, see, whenever you get, because match the following question is a forte of INICET exams. Okay, they always give you. So like you all know James Lind, prevention of scurvy by citrus fruits. Okay, so whatever you're very sure of, you mark that first. Prevention of scurvy by citrus fruit. What do you know about Edward Jenner? You know he worked for smallpox vaccination. He's the first one to discover smallpox. We know that Walter Reed is for yellow fever. So 1B as you can see, 2C you can see, as well as 3A you can see. So what I'm trying to tell you is you can get a couple of scientists in your exams. Yes, this also FMG students can attend. It is nothing like it's different. PSM is almost the same for all the exams. Couple of things are important for INICET which will be discussed here, but no harm in attending the session. You'll get to revise the PSM. Alright, chalo, moving ahead. Now since you get a match the following, I hope you remember who these people are. I hope you remember who these people are. This one right over here, who is he is John Snow. He's the father of modern epidemiology. This, since they gave the scientists, they could ask you this also. Edward Jenner, he discovered the first vaccine, smallpox vaccine. He is Robert Koch, who gave the Koch postulates. He is Louis Pasteur, who discovered the anthrax and rabies vaccine, as well as gave the germ theory of disease. This one right here is James Lind. A quick session, so I'm quickly writing these points so that you don't miss out. Okay, this one, guys, he is Walter Reed. Okay, he worked for yellow fever. And this one right here is Ronald Ross. Ronald Ross shows that malaria transmission occurs due to anopheles. Also, if when you get the PDF, you will have a list of all the scientists and the important contribution here, which we have just studied. John Snow, remember, his was the first natural experiment or quasi-experimental. This is a PYQ which came long back in INICET. The first natural experiment was John Snow's. Edward Jenner, Robert Koch, Louis Pasteur, James Lind, Walter Reed, Ronald Ross. Social pathology was a question in NEET PG, which could get repeated in INICET as well. So this one you can just go through this presentation. Yeah, David Morley gave the growth chart. David Morley gave the growth charts. All right, done with the first question. Yeah, done with the first question. Give me a thumbs up. Everybody understood the first question. Let's move ahead. They can ask you the scientist, why not? Okay. Now, one of the favorite questions in INICET is the National Program for Control of Blindness and Visual Impairment. This is one of the favorite programs, particularly of INICET. NEET PG people also ask, ठीक है, FMG can anytime turn up to asking about them. So tell me the answer to this. Which of the following is not true about National Program for Control of Blindness and Visual Impairment? Option A. Patients requiring cataract surgeries are selected and asked to report to the base hospital. Option B. To perform small incision cataract surgeries. Option C. To perform surgeries in rural areas with makeshift hospitals and OTs. Or option D. Perform surgeries in fixed facilities by shifting patients from rural areas. What is your answer? Very good, guys. Now see, cataract we know is the most common cause of treatable blindness among people. Right? Cataract is completely treatable. So those who require cataract surgeries are selected and are asked to report to the base hospital where the surgeries is being done. That's correct. We perform small incision cataract surgeries. Alright. Also surgeries are performed in fixed facilities by shifting patients from rural areas. This is wrong. What do you mean by makeshift hospitals, guys? Makeshift hospitals and OTs are, like suppose there's a war happening or there's a military camp or there is some disaster has happened, so we set up temporary hospitals. Those are known as makeshift hospitals. The temporary hospitals that we set up are known as the makeshift hospital. So we will not perform surgeries in rural area and shift people to the makeshift hospitals and OTs. No, we will bring the people from rural areas, take them to the fixed facilities and perform their surgeries. Clear? Everybody give me a thumbs up if you understood the concept of makeshift hospitals over here. Alright, makeshift simply means that some temporary facility that has been set up. Okay, a temporary facility that has been set up. So we won't perform surgeries in rural areas and shift them to the temporary hospitals. Alright, okay, another couple of questions from this program. What is the definition of blindness? I'm sure all of you know. Visual acuity less than 3/60 in better eye with available correction. Better eye with available correction. Better eye with available correction. And when I ask you visual impairment, it is visual acuity less than 6/18 in better eye with available correction. Most common cause of blindness in adults is cataract. Most common cause of preventable blindness in adults is trachoma. Most infective trachoma. Most common cause of preventable and treatable blindness in children is vitamin A deficiency. Okay, hello. Let's move to the next question of the day. Let's see. All these are PYQs, guys. I am just discussing the PYQs so that you get a grasp of the topics that could get repeated. ठीक है, आगे बढ़ते हैं. Look at the question. A 10-week-old baby has come for vaccination. The baby has had a previous history of inconsolable crying and fever after vaccination at 6 weeks. What should be the next step now? Okay, so you're writing the answers. Good. Don't give DPT, give DPT. Don't give DT, defer for 1 month. The only thing which was an update which I had shared long before also, inconsolable crying following the DPT vaccination, no longer an absolute contraindication. It is no longer an absolute contraindication for subsequent doses. For subsequent doses. No longer an absolute contraindication for subsequent doses. So what are you going to do? You will be giving the DPT. You don't need to defer DPT. But yeah, one of the problems with pertussis, guys, this pertussis component is very, very dangerous. It can also lead to seizures. So if any baby gives you a history of seizures which is not controlled on anti-epileptics, then you will not give the DPT. But if a baby has seizures, next time they can ask you this, a baby was suffering from seizures, but the seizures is controlled on anti-epileptics, please give DPT, give Penta, then it is no longer a problem. Encephalopathy, of course, HHE and anaphylaxis, they are contraindications. Okay, moving to the next one. Guys, you'll have to do this. I'll just be back in 1 second. Okay, so what did you write for this, everybody? Let me see which of the following best helps assess issues in quality of healthcare. This was a MCQ, this was a PYQ. Now some of you are writing histogram. Histogram नहीं. Histogram क्या करता है? If you remember, what was the image of the histogram, guys? Histogram is frequency of continuous variables. Frequency of continuous. Continuous variables means quantitative variables. Quantitative variables. And what about bar? Now don't get confused. See, bar is a 3-letter word. BAR, it's a 3-letter word. And GAP, gap, is a 3-letter word. So wherever you see gap like these, it is bar. And when you see gap, gap means I'm talking about frequency of which variables? I'm talking about frequency of discrete variable. I'm talking about frequency of qualitative or discrete variable. What about risk regression model? Okay, and histogram is completely joint. These are joint columns because continuous. Quantitative, you can measure them. They can be expressed in decimals. Now, what does regression model tell us? See, if correlation tells us like this is a positive correlation, okay, now if the variable on the x-axis increases, the variable on the y-axis is increasing. But what does regression tell us? Regression tells us that if the variable on x-axis increases by 1 unit, if variable on x-axis increases by 1 unit, okay, how much variable on y-axis increases by? How much variable on y-axis increases by? Variable on y-axis increases by. That means what does regression tells us? It tells you about the unitary change. It tells you about the unitary change. Here the question was issues in quality of healthcare. The answer to this is Ishikawa diagram. What is the answer? Ishikawa. Next time they can give you an image. So can you all check out this image, guys? This is a fishbone diagram, or as I can tell you, this is a Ishikawa image. Now Ishikawa diagram. What is the meaning of this? See, in healthcare, what happens to assess the quality of healthcare? Sometimes we have to know the cause and effect model. Now this is the effect, the possible causes, option 1, option T. The possible causes is being told to us by the cause effect model, which is what? The fishbone or the Ishikawa diagram. Thumbs up, everybody. Okay, so there are a couple of more statistical images which are expected in exams that we will see as we proceed forward in the session. Okay. Tell me the answer to this. One of the questions that came in your INICET, one of the most expected topics also, biostats. Formula given below corresponds to, this is whole square if you can't see, okay, and this is summation and this is log root. What is it? I don't have to discuss too much about this. This is standard deviation. But why is it written n-1? Why is it written n-1, anybody? Over here, when the sample size is less than 30, then it is going to be n-1. If the sample size is more than 30, then standard deviation is nothing but summation of x minus x bar, alright, or you could write mu I minus mu whole square by n. What is the formula for variance, guys? That is also a commonly asked question. Variance, we all know, is standard deviation square. And another formula that INICET is fond of asking, COV. What is COV? Coefficient of variation. Coefficient of variation. What is it? Now see, variance is standard deviation square. Coefficient of variation is standard deviation upon mean into 100. Standard deviation upon mean. And covariance is standard deviation square. Mean, you all know, sum of all observations divided by the total number of observations. What is median? The middle value when data is arranged in ascending or descending order. Okay, all are measures of dispersion. Also, one more important point for INICET, should the measures of dispersion be high or should they be low? So remember, measures of dispersion should be low. Measures of dispersion should be low. Why? They should be closer to the central value. If the measures of dispersion are low, more reliable the data set, more reliability of the data set, more reliability. And reliability can be increased by increasing what? The reliability can be increased by increasing the sample size. Okay? Another MCQ we've done, measures of dispersion should be low, that means more reliable, and it can be increased by increasing the sample size. Alright. Another PYQ. Now they left the common types of distributions that are asked. What is the question over here? Discrete probability distribution that expresses probability of a given number of events in a particular time frame. Normal distribution, skewed distribution, Poisson's distribution, Gaussian's distribution. Now if it was NEET, PG or FMG exams, normal and skewed would be expected. But since we are talking about INICET, one more type of distribution we will see over here is Poisson's. This is discrete probability distribution. Like suppose on an average, when will a meteorite strike the earth? Alright, that is what is Poisson's. Now this like you can see an image over here. What is this image? Next time they can give you the image of a Poisson's distribution. They will not ask you the definition, they will ask you the image. So this is over here the image of Poisson's. Alright, this is the image of Poisson's distribution. What is Poisson's distribution? Poisson's distribution simply means we can predict when meteorite will strike the earth. We can predict, suppose I own a restaurant, when I will get the maximum customers on which day of the week in my restaurant. So there is a value, there is a variable which is given over here. Can you see lambda? I'll just zoom it. Based on this lambda, we make the predictions. So now as the exam is very near, we cannot go into too much of detail. So just check out this image, that this is about Poisson's distribution, and the buzzword that you will remember with it is discrete probability distribution. Tells us about the rate of event occurrence. Rate of event occurrence. Alright, thumbs up. I need a thumbs up that you understood. And of course, I'm sure everybody remembers normal distribution. Something like this. For this, mean is equal to 0, standard deviation is equal to 1. What about skewed distribution? I'm sure you all know this. Right and left sided skewness. For right, look at the direction of the tail where it is pointing. Right is mean is more than median is more than mode, and left is mean is less than median is less than mode. Okay, Gaussian is the same as normal. Yes, more lambda, more chances. Going to the next question, socially acquired learned behavior is called as? Socially acquired learned behavior is called as? दीदी मेरा दरवाज़ा खींच दो. Socially acquired learned behavior, good. Socially acquired learned behavior is culture. So just quickly when you revise, do try to go through the definitions of sociology. Customs is what? Established pattern of behavior. Established patterns of behavior. Custom is established pattern of behavior. And customs is of two types, guys. Folkways and mores. Mores are more stringent customs. Mores are more stringent customs. And if you talk about folkways, folkways are less stringent. Folkways are less stringent. Socialization is how we adopt the culture and become a part of the society. So go through that. And one more word that I think can turn up since they asked about culture, customs, acculturation. What is acculturation? Cultural contact. Cultural contact, or you could also say exchange of cultures. Like people of two different cultures get married. You go to study somewhere else. Conquest or industrialization, all of that are acculturation. Alright, moving ahead. For which of the following infections, airborne infections, it is necessary to isolate people in a separate room? INICET, fond of infectious disease epidemiology. Questions like these, SAR calculation, CFR, incubation period. So in the PDF, I have also given out incubation period, period of communicability, isolation period. You can check that out later in the PDF. What is your answer? Very good, measles. So measles isolate people in a separate room. Alright, measles. Measles is what type of infection, guys? If you talk about measles, measles is airborne droplet nuclei. Measles is airborne droplet nuclei. So once they had also asked the question, what is the difference between droplet and droplet nuclei? What is the difference between droplet and droplet nuclei? Droplet nuclei means airborne. So if you have to talk about the difference, in the droplet, the size of the droplet is more than 5 micron. When you talk about airborne, the size is less than 5 micron. So droplets are heavier. They fall to the ground under effect of gravity and they will travel a distance of less than 1 meters. But airborne means they remain suspended. They are lighter. So they are going to travel a distance of more than 1 meter. What are the diseases with this? That is an important question. You should remember, like I said, measles. Whenever we talk about measles, we also talk about chickenpox. TB, measles, chickenpox, TB, influenza, COVID. All of these follow airborne infections. All of these are airborne infections. They mentioned airborne infection, that is why the answer is measles. Okay. Moving ahead, rabies, again a favorite question, whether it's NEET, FMG, INICET, so all these are PYQs. Now instead of asking you the vaccination schedule, they asked about immunoglobulin. So can you tell me the answer to this? Which of the following statements is false regarding rabies immunoglobulin? Option A, it is exclusively given only in the deltoid. Option B, the dose is 20 international unit per kg. Option C, administer it immediately after exposure. Option D, if human RIG is unavailable, equine is preferred. So you had to tell me the false. Also, when you appear in any competitive exams, be very careful with the word true, false, all other than, which out of the following, those can confuse you. Is it given only in the deltoid? No, this is false. Where do we give the immunoglobulin? Max is given around the wound. Max around the wound area. Maximum is given around the wound area. Which one do we prefer? Human immunoglobulin. Human immunoglobulin. And the dose for that is 20 international unit per kg. Administer it immediately after exposure. Yes, you should. Particularly in which wounds, guys? Category 3. Alright, category 3, when bleeding is present. However, for HIV positive, give immunoglobulin also in category 2. If human immunoglobulin, okay, one more question. Immunoglobulin can be given up to 7 days from the first dose of vaccine, can be given up to 7 days from day 0, can be given up to 7 days also from the first dose of vaccine. If human is not there, of course we will give equine. Okay? The dose of equine was 40 international unit per kg. Okay, I hope you remember this schedule. For India, we prefer updated Thai Red Cross regimen. Updated Thai Red Cross regimen. Thai Red Cross. How have we learned it? Thai, I, India. India prefers this one. D. D is what? Intradermal. Thai has how many letters? 4 letters. Thai has 4 letters. So how many visits are we going to make? 4 letters. So we are going to make 4 visits. Day 0, 3, 7, 28 days, and 2 sites simultaneously. Okay. Also, for children, thighs. For adults, it is given in the deltoid. And one more question which could come, re-exposure. Re-exposure prophylaxis. Do remember, re-exposure, if it is within 3 months, just clean the wound. Okay, no vaccine, nothing. But if it is beyond 3 months, now as you can see, re has 2 letters, so 2 doses. When will it be given? Day 0 and 3. Whether you give ID, IM, either will do. Alright, so that's the revision we have done for vaccines also. I hope I'm not going too fast. It's okay, right? Can we continue? Alright, Contraceptive failure, favorite of INICEtfmge. But now since it is INICET, instead of asking you which method is commonly used, they can ask you which method is, okay, over here I missed an index, Pearl index. I missed an option also, sorry. Yes, now since I asked you best method is life table analysis. It tells us about the individual months of exposure. But Pearl index is the most common method used to evaluate contraceptive efficacy. Pearl index, that's the most common used. Okay? And you will also get a calculation of Pearl index. Thank you, Vikram. God bless you. Now you can also get a calculation of Pearl index. Let's once quickly revise the formula of Pearl index. What was the formula of Pearl index? Total number of accidental pregnancies divided by the total months of exposure multiplied by 1200. 1200 is the number of months in 100 years. We always express Pearl index in terms of 100 woman years, failure rate in 100 woman years. So this you should remember. If suppose they say 100 couples used a contraceptive for 2 years, if suppose they say 100 couples use contraceptive X for 2 years, what will you say as the total months of exposure? Don't just say 24 months. You will say 100 into 1 year has 12 months, so 2 years has 24 months. So what will be the total months of exposure? 2400. I'm just trying to tell you that instead if they write total months of exposure, 100 couples are using for 2 years. So don't just write 24 months. It's 100 into 24. Don't make that mistake, okay? Many students miss out on that. Don't do that, okay? Just trying to tell you where you can end up making a mistake. Alright, let's go to the next one. Again, a favorite PYQ which we have, I think, done in our LRR also, which was conducted on PrepLadder YouTube. You can go through that as well. A new drug has been introduced into the market which is found to decrease mortality, but it does not cure the disease. Which out of the following is a true statement regarding prevalence and incidence? Which out of the following is a true statement regarding prevalence and incidence? We all just have to follow the formula P is equal to I into D, incidence into duration. Now over here a new drug has come which is decreasing mortality. Decreasing mortality means it is not letting the people die, but it is not curing the disease. A person is going to live longer with the disease. Does not cure mean the person will live longer with disease. The person will live longer with disease. Does not cure means the person is going to live longer with disease. So when somebody is going to live longer with disease, D increases. So automatically what is going to happen? P increases. But if somebody asks you what is happening to the incidence, what is happening to the incidence, guys? Incidence will remain the same. Why the incidence is going to remain the same? The incidence is going to remain the same because the risk factors are the same. A drug will not act on the risk factors. Okay, the drug will not act on the rate at which new cases are occurring. It's going to act on the people who already have the disease. If the person was getting cured, D would have decreased. Alright, then P would have decreased. If you have a new prophylactic intervention, something that will cater to the risk factor, then only incidence will decrease. Like vaccinating a baby at 9 months. The chances of children developing measles, that decreases. So incidence decreases, in due course what happens? Prevalence decreases. Okay? Alright, go to the next one. Again a favorite question. A study for smoking and lung cancer finds attributable risk percentage for smoking as 95%. All are correct interpretation except. Can you answer this? All are correct interpretation except. I am asking you the interpretation of attributable risk. If it was NEET, PG, FMG exams, I would have stressed more on relative risk. Since we are talking about INICET, it's not that NEET or FMG exam cannot ask this. Okay? More chance of this being asked is in INICET. PAR, AR. Alright, so attributable risk. First of all, which study design do you calculate attributable risk from? You calculate from a cohort study. What is the formula? It is incidence upon exposed, incidence among, exposed minus incidence among non-exposed, incidence among non-exposed divided by incidence among exposed, and what are you going to multiply? You will multiply it with 100. Alright, now look at the first one. 95% of lung cancers can be avoided in smokers if smoking is eliminated. Is this correct? Yes. Why? Attributable risk focuses on incidence among exposed. So if suppose I get a value 95%, so 95% of cases of lung cancer can be avoided in smokers, that is exposed, so that is correct. Next, 95% of lung cancer can be avoided in general population. No, if it was general population, it would have been PAR. It would have been PAR. What is PAR, guys? Population attributable risk is incidence among the entire population minus incidence among non-exposed. Okay, incidence among non-exposed divided by incidence among total population multiplied by 100. So if I had used the buzzword here was, if I had used population like here, it would have been PAR. Next, fraction of people who develop disease among exposed, absolutely correct. Denominator is exposed, the fraction of people who develop disease among exposed out of the exposed. Another way of saying is, it is measured by dividing risk difference by incidence of disease in exposed. Now what is risk difference? Risk difference is incidence exposed minus non-exposed. So they just tried to trick you with the question. I can just say in exam, option D can come as a question. They can ask you which indicator measures the risk difference between incidence of disease exposed and non-exposed. So risk difference is which one? Attributable. Risk difference, incidence population and non-exposed, PAR. But exposed and non-exposed risk difference, attributable risk. So what was the correct answer here? The wrong statement, option B. Clear? Give me a thumbs up. Everybody understood this one? You could get in your exam, so you should know it. Alright, moving forward. Which of the following quantitative method is the best to study previous research studies? What are the ways to study previous research studies? What are the ways by which you can study previous research studies? What are the ways by which you can study previous research studies? Previous research study, to study, we can't go into too much detail here, but to study previous research studies, you have two ways. What are those two ways? One is systematic review, and the other one, guys, is meta-analysis. Now what is the difference between the two methods? What is the difference between a systematic review and a meta-analysis? In systematic review, we'll just review the articles. There is no quantitative synthesis being done, or there is no quantitative analysis. But what is meta-analysis? The word over here is analysis. So you have to do some analysis. So what is meta-analysis? It is nothing but SR plus systematic review plus quantitative analysis. It is actually a review with quantitative analysis. In meta-analysis, we are going to do everything that we do for systematic review. At the end, we will also do a quantitative analysis. So the quantitative method to study previous research articles is what? Meta-analysis. What do you draw in a meta-analysis that you don't draw anywhere else? This quantitative analysis, how do we depict in a meta-analysis? That is depicted by the forest plot. The forest plot, which is going to give you one single estimate, one pooled estimate. All right. And which is the image that you draw for both systematic review and meta-analysis, guys? What is the image that you draw for both systematic review and meta-analysis? For systematic review and meta-analysis both, we draw something which is known as, everyone, funnel plot. That is what? Funnel plot. That was checking for, we draw something like this. This is checking for publication bias. Cannot right now go into too much detail, but you know INICET is fond of asking about SRs and MAs, so just discussing a little bit, okay, over here. Alright, see, another time they ask this one. Which of the following is not a component of meta-analysis? They also ask about steps of case control. They also ask about steps of cohort, but they also ask about meta-analysis. So now what is the answer to this? Which of the following is not a component? Good. Randomization, of course, is not a component. Selection, analysis, abstraction. Abstract means to take out the content. When we read the articles, we read the abstracts of the articles and come out with the necessary information. Randomization is definitely not a part. So you should revise steps of cohort. What will be the buzzword in step of cohort? As I have taught you in LRRs, RRs, everywhere, steps of cohort, the buzzword is follow-up. And steps of case control mein, how will you identify? For steps of case control, the buzzword will be matching. For a cohort, you select exposed, non-exposed. In case control, you select diseased, non-diseased. Okay? Moving to the next question. Function responsibility of ASHA worker. Sorry. Sorry, guys. Yeah, matching is a buzzword in your case control, and matching only eliminates the known confounders. Randomization can eliminate both known and unknown confounders. Okay, now let's read each of the statement and answer. ASHA worker accompanies pregnant females to the hospital. Of course, this is true. She helps in completion of immunization as per schedule. She definitely helps in completion of immunization. She will help in completion of immunization. But can she give vaccines? Please remember, ASHA worker does not give vaccine. ASHA, no vaccine, does not give vaccines. No vaccine. She will ensure that everybody receives the vaccine, but she herself cannot give vaccine. No delivery. She will carry a delivery kit with her, disposable delivery kit, but she is never going to perform. She's not been trained for that. Okay, who all can perform delivery in case you get in an exam? Which paramedical staff? ANM can do and TBAs can do. Alright, Anganwadi worker, however, can give vaccines. Anganwadi worker can counsel pregnant females also, can give vaccines also. Okay, spread awareness regarding contraception, of course. Malaria slide, no, this is multi-purpose worker male. Multi-purpose worker male. So if ABC are correct. Now over here I just wanted to discuss ASHA. I hope you all remember 25 to 45 years. She is 10th pass. Don't say 8th pass. 10th pass. 1 ASHA per 1000 population is the existing norm. Existing norm. And what is the proposed norm? 2 per 1000. 2 per 1000 is the proposed norm. ASHA worker is selected by the village panchayat under supervision of medical officer. Training duration is 23 days. Okay. Alright, moving ahead, tell me the answer to this. Good indicator of availability, utilization and effectiveness of health service in a country is. Good indicator of availability, utilization and effectiveness of health service in a country. Effectiveness, yes, the answer to this is infant mortality rate. If somebody asks you, what about the others? We will discuss the definitions also. If somebody asks you, what about the others? So look over here. I'm just going to take you to a slide which I have shown you in LRRs also, but I will discuss it once again. Best measure for burden of disease and effectiveness of intervention, DALI. Okay, but if anybody asks you best measure of cost effectiveness of intervention, if somebody asks you best measure of cost effectiveness of interventions, cost effectiveness of intervention is quali. Cost, how many years get added to your life due to a medical intervention. Overall development of a country, IMR. But if somebody asks you UN indicator, United Nations, under 5 mortality rate. Best measure of quality of healthcare delivery services in a population, maternal mortality ratio. Best measure of combined obstetrics and pediatrics care, perinatal mortality rate, PMR, perinatal mortality, PMR, all right, perinatal mortality, all right. Okay, everyone, so do remember these couple of points which could come in your exams. What is the answer to this? Minimum number of antenatal visits as per new WHO guidelines. New WHO guidelines, what is the minimum number of ANC visits? Minimum number of ANC visits, we all know WHO has now said 8. No confusion in this. WHO has now said 8. So we'll just have a look over here. See, Government of India is 4. Recommended or ideal, so pay very good attention to the question. This is ANC visits. Recommended or ideal is 13 to 14. WHO minimum is 8. WHO minimum visits is 8. First trimester 1 visit. Second नाम है तो second trimester 2 visits. The remaining in the third trimester, which is how many visits? 5 visits. Alright, remaining in the third trimester, which is how many visits? 5 visits. Alright, next question. Guys, isko padho. Read this question and then you know what I'm going to do is I'm going to ask you about each of this statement and you will have to tell me which statement is correct and which statement is incorrect. Okay, like you read, then I will ask you, okay, is the first statement RAM and index case correct or not? Like I told you, INICET is fond of infectious disease. Now dekho, since it's INICET, they gave it in this form of question. NEET, PG, FMG, they'll straight away ask you what is index, what is primary case, but everybody is revolving around the same topic, which is of infectious disease epidemiology. They are asking you question of that only. Okay, so look at the question. 5-year-old Ram and 3-year-old Sham are Rama Devi's sons. Sham developed a rash, but Rama Devi ignored it. Okay, assuming it to be an allergy. Fine. After 10 days, Ram also developed a rash along with fever. Out of fear, Rama Devi took Ram to the PHC. The healthcare workers of the PHC suspected it to be measles. Choose the correct options. So tell me, is this first option correct, that Ram is an index case? Everybody just put in the comment section true or false for the statement number 1. Ram is an index case. Ram is an index case. Is it correct? What is an index case? What is an index case? Index case is the first case. Index case. Index case is the first case to come to the notice of investigator. Index case is the first case to come to the notice, to come to notice of investigator, to come to the notice of investigator. First case to come to the notice of investigator, or you could also say epidemiologist, or you could also say epidemiologist. The first case to come to the notice of investigator or epidemiologist. So here Ram Devi ignored it when Sham developed a rash. Ram also developed. So Ram Devi took Ram to the PHC. So Ram became the index case. He was taken to the PHC and he came to the notice of the investigator. Sham is a primary case. Of course, Sham is the first person who has developed the disease. So Sham is a primary case. Actually, yes, Sham is the first case. What is a primary case, everybody? What is a primary case? Primary case is the first case of infectious origin. First case of infectious origin introduced in the population. First case of infectious origin introduced. First case of infectious origin introduced. Now, where did Ram get infection from? At that particular incubation period, Ram got infection from Sham. This is also true. This is an example of secondary case. Ram got infection from Sham. This is a secondary case. Now look, Ram could have received post-exposure prophylaxis if his mother had brought him to the hospital when Sham got the rash. Exactly. That time Ram did not have the infection. He was in the incubation period. So we could have given him post-exposure prophylaxis and Ram could have been saved. So what is it? All the four statements are true. Did you see? If it was NEET or FMG exams, they would have asked index, primary case, something like that. Here they made a story. Topic is still the same. Okay? Okay, let's go to the next one. Chemoprophylaxis of leprosy should be given to all contacts except leprosy, like I said, is a favorite of examiners. So chemoprophylaxis of leprosy should be given to all contacts except, what is your answer? Household contacts living with a leprosy patient for more than 6 months, social contact of 20 hours per week for 3 months, age more than 1 year. So what is your answer over here? Some of you are writing, let's see what you write. Guys, what is the drug used for prophylaxis of leprosy? It is rifampicin. It is rifampicin. Now you will give it for age more than 2 years, not 1 year. Age more than 2 years. People living in the same house will get it. Living with a leprosy patient for more than 6 months will get it. Social contact of 20 hours per week. Okay, if I come in contact with the patient 20 hours per week for 3 months, I also have to take it. So here I have also mentioned the doses. Single dose rifampicin for more than 2 years has to be given. 600 milligram more than equal to 15 years. You never know when they can end up as, because it's INICET, they ask the doses. So do go through the doses, study your pharma nicely. Important doses: TBK, leprosy, HIV, pharma से एक बार doses cross check, malaria, ठीक है, because INICET is fond of doses. Children 6 to 9 years, 300 milligram. Below 20 kg, 10 to 15 milligram. I've just summed it up for you. You can go through in the PDF later. Who are social contacts, household contacts, as well as neighborhood contacts. 3 houses this side, 3 houses that time. Okay. Moving ahead. Another question. All are PYQs, so you don't have to worry. Didi, मेरा दरवाजा खींच दो please. Chalo, what is the next question? Which of the following indicator shows the efficacy of early detection of leprosy in NLEP, National Leprosy Eradication Program? Efficacy of early detection. Efficacy of early detection means efficacy of early detection. Yeah, it has to be given once. Okay. Efficacy of early detection means, is the program running well or not? What is your answer? क्या लिख रहे हैं सारे कोई? Good. Grade 2 disability cases. Good. This is telling us about the operational efficacy of the program. Now, what is this, guys? What is this? Annual new case detection rate per lakh population. This is a operational indicator. Okay, this one over here is a operational indicator. Efficacy is the program running well is this one. If you talk about prevalence rate is the impact indicator. Prevalence rate is the impact indicator. So over here I have written for you, impact indicator is prevalence rate. Leprosy has been eliminated. We all know leprosy has already been eliminated. What is the elimination criteria? Less than 1 case per 10,000 population. Like suppose I go outside in my community and I start surveying the population. I should, for every 10,000 population, I should not even have a single existing case. Prevalence means existing cases, new or old. It should be less than 1. That means not even a single case per 10,000 population. What is operational indicator? Annual new case detection rate. What is this? This is annual new case detection rate. Annual new case detection rate. What does this mean? It means that if I survey every 1 lakh population, I should get 10 cases, all right, 10 cases per 1 lakh population. If I get beyond that, it means the program is not running well. All right, less than 10 cases we should get per 1 lakh population. If I start surveying the population here, I should find new cases for every 1 lakh population less than 10. ठीक है. And of course operational impact indicator, operational indicator and efficacy indicator if the program is running well is grade 2 disability cases. ठीक है. Look over here, this is just a summed up thing. Most important epidemiological indicator, most important operational indicator is ANCDR. Most important operational, you can also have grade 2 disability. Operational में you can also have ANCDR, but for operational more important is to mark grade 2 disability. Health awareness, leprosy awareness also grade 2 disability. ठीक है. Yeah, it is for NEET PG as well. Just a couple of images. This is your logo of the program. What does this symbolize? This is the patient over here. This hand is the name of the program. Okay, this one is NLEP, the program, and this one is MDT, multi-drug therapy that we are giving to leprosy. And this one is Sapna. She is Sapna. She was a cured case of leprosy. Sapna was a guys cured case of leprosy. She is now spreading awareness. And Meena, I don't have the image now. You can check in LRR. Meena is a girl with a parrot. Girl with a parrot. Meena is girl with parrot. And Meena ka concept was given by UNICEF, which was for child's right. Which was for child's right. Okay? Alright. Let's move ahead, everybody. Just quickly revise tetanus management. Yeah, SPARSH program. Okay, let me write it here for you so that when you're revising, you revise it. Sapna is under which initiative? SPARSH initiative. SPARSH initiative is for leprosy awareness only. Okay, going to the next one. A person has received complete immunization of tetanus 10 years ago, now presents with a clean wound without any lacerations from an injury which was sustained 3 years ago. He should be given. Also guys, we are aiming for a leprosy mukt Bharat by 2027. I'm writing over here leprosy mukt Bharat. Leprosy mukt Bharat is by 2027. INICET can ask these dates, okay? Alright, now over here you just have to remember the categories. You have 4 categories. Category A, B, C, D. You have to divide into clean wound, unclean wound. What is category A? Just revise with me this table first. One thing also notice, in unclean wound only you will give the immunoglobulin. You will never give the immunoglobulin in clean wounds. Full immunization within 5 years. So clean or unclean, only wound care. Full immunization more than 5 years ago but less than 10 years. Clean or unclean, wound care. TT single dose. Don't say TD because this is a trauma case. So TT. Full immunization beyond 10 years, everybody. Beyond 10 years. Wound care plus TT, but beyond 10 years you will have to add immunoglobulin in unclean wound. Nothing is known, never taken immunization. Wound care plus complete the course. For unclean wound also add the immunoglobulin. Got it? Okay. So now over here let's take the question. The person has been immunized against tetanus 10 years ago. That means falls in category C. Now however he presents with a clean wound. So category C, clean wound. What are you going to do? You will also only give a single dose of TT. Got it? See, category C more than 10 years but it is a clean wound, so only single dose of TT. Everyone, revision of tetanus done. Just remember this one, not option, yeah, option B, single dose of TT. Okay, so trauma cases, TT. Moving ahead, let's see this one, PYQ. 12-week primary has come for checkup. I just wanted to revise the calorie requirements over here. So we're going to do this question. 12-week primary has come to you for checkup. What is the advice she should get regarding additional calorie requirement? What is the advice she should get regarding additional calorie requirement? What is your answer over here? Advice regarding additional calorie requirement. Now over here, if you tell me, ma'am, 350 in all trimesters, that's okay, that's correct. Average is 350 in all trimesters. Average is 350 in all trimesters NIN. But if you talk about your trimester wise, guys, if you talk about trimester wise, remember if you talk about trimester wise, remember one thing. In the first trimester, the pregnant female requires no extra calorie, technically speaking, or just around 75 to 80 kilocalories per day. Calorie is okay. In the second trimester, it is in the range of 200s. 250 to 290 kilocal per day. This is in the range of 200s. If she is in the third trimester, maximum weight gain of the baby occurs in the third trimester. So if she is in the third trimester, she would require 390 to around 450 kilocalories per day. So you can remember in the third trimester maximum weight gain, so it is in the range of 400. So additional calorie of 400 she will need in the third trimester. In second trimester she needs in the range of 200. 350 in all trimester, if you take out the average, it will come out to be 350, guys. Okay? But since you are asking about trimester wise, remember first trimester no extra or very less below the 100, second trimester in the range of 200, third trimester maximum weight gain, so in the range of 400s. Alright, so since they've asked about calorie, go through this chart later whenever you have free time. I've discussed this in LRR also. Sedentary worker man, you can remember 2100, moderate worker man 2700, moderate worker woman 2100, 2700. So they are the same. 1660 you can remember 1700, double of that 3400. Alright, first trimester for lactation, first 6 months plus 600, 7 to 12 months plus 520. And one more for PYQ importance, increased nutrient during pregnancy, iron, folic acid, protein, zinc, increased nutrient during lactation, calcium, vitamin A, vitamin C, iodine and carbs. Carbs almost 200 grams per day is needed. And when you get the PDF, go through this chart as well. For this, I just want you to remember this value of lactation for iodine, which is asked in different exams. You can get this in your questions as well. Maximum weight gain in pregnancy, look over here, plus 10 kgs, 9 to 11 kgs. If a woman is lower class, 6 to 7 kgs. So you can go through this. One hinge that I have, they can ask you about diabetic diet. So I've brought this written for you, diabetic diet. Diabetic diet mein cholesterol below 200, sodium 2000, salt less than 5 gram. Important over here is fiber. Now anywhere, guys, if you look at a diet which is known as prudent diet is also a diet to prevent cardiovascular diseases, prevent CVDs. all right, now in prudent diet also this is followed. Saturated fat below 10%, ideally it is 7 to 10%. However, total fat intake in your diet should be 15 to 30%. Cholesterol, the one that INICET asked, cholesterol HDL ratio should be below 3.5, should be below 3.5. Okay, all right. Moving ahead, let's give me the answer to this. A PYQ, Anemia Mukt Bharat, NEET PG, FMG, INICET. Everybody asks about Anemia Mukt Bharat. What is your answer to this? Anemia Mukt Bharat, everybody asks, a pregnant woman less than 34 weeks gestation reports mild to moderate anemia. Alright, mild to moderate. What is the best management? Mild to moderate, less than 34 weeks. 2 tablets IFA plus injection iron sucrose. 3 tablets IFA per day. IV iron sucrose, a woman is not tolerating IFA. I am ferric carboxymaltose. What are you going to do in Anemia Mukt Bharat management? See, for NEET PG FMG, prophylactic iron folic acid administration we have discussed in our LRRs as well. For INICET, the management part is important. So let me straight away take you to the management. Look at the management plan, everybody. Look at the management plan. Mild to moderate anemia. Mild to moderate anemia. So you divide below 34 weeks gestation, beyond 34 weeks gestation. If it is mild to moderate and she can take IFA, give her 2 tablets IFA. Prophylactically, we give 1 IFA, 60 milligram elemental iron, 500 microgram folic acid. But in case she is not tolerant to IFA, then only you will give IV sucrose or IV ferric carboxymaltose. You are never going to give IM. But even if she has mild to moderate anemia, but the gestational age is more than 34 weeks, then you will not rely on oral. You will rely on IV iron sucrose or IV ferric carboxymaltose. But if the woman is a victim of severe anemia, whether it is hemoglobin 5 to 6.9 or below 5, first or second trimester or third trimester, you will never talk about drugs oral. You will always go for injectables. If it is between 5 to 6.9, IV iron sucrose or carboxymaltose in the first or second trimester. If it is less than 5, obviously hospitalize. In third trimester, you have to hospitalize. Okay. The prophylactic iron folic acid, that you can any which way study from your LRRs and the other places as well. Management is important for INICET exams. So let's go over here. What was the question saying? She is less than 34, mild to moderate. What should I do? I should give her iron tablets, 2 prophylactically. So 2 tablets, yes. Why will I add injection iron sucrose? Gone. 3 tablets of IFA per day? No, I have to give her 2 tabs. IV iron, IM to dena hi nahi hai. You can't give. So IV iron sucrose if the woman is not tolerating IFA. Clear everyone? Give me a thumbs up in the management of this one. This is IFA Anemia Mukt Bharat. These are the interventions. You can go through interventions. Prophylactic iron folic acid deworming is being done. 10th of August, 10th of Feb, 10th of August are the 2 deworming days. Pregnant females is also being given. Health education, delayed cord clamping, testing of anemia, mandatory provision of iron folic acid food, addressing non-nutritional causes of anemia. Okay, one question. Iron ki neeli goli, blue iron tabs, which group you could get in INICET? Blue iron tabs, which group? Iron ki neeli goli is being given to whom, everybody? It's being given to adolescents. It's being given to adolescents. 10 to 19 year weekly. Okay, 10 to 19 years weekly. Every week. 60 milligram elemental iron, 500 microgram folic acid. Okay, moving ahead. Again, a favorite question about markers of malnutrition. A 5-year-old has the following anthropometric findings. Weight for age below 3.2, minus 3.2. Weight for age. Height for age less than minus 2.5. Weight for height. What will you say? Anyone? First of all, tell me, low weight for height is an indicator of acute chronic or acute on chronic malnutrition. Low weight for height, guys. No answers have come up. Why? Okay, let's see if you can do it. Low weight for height is an... Think, bacha, think. Low weight for height is wasting. Alright, wasting, or it is an indicator of acute malnutrition. It is an indicator of acute malnutrition. Okay? Low height for age. That is what, guys? Low height for age. That is what? Low height for age is stunting. Stunting means indicator of chronic malnutrition. Okay? Then low weight for age. What is low weight for age? It is underweight. It is underweight, which is acute on chronic. NEET PG-FMG exams, they directly ask you this. INICET, they went one step ahead. Now, if you remember your growth charts or the charts also, we always say if somebody falls below minus 3, it is severe malnutrition. If somebody is between minus 2 and minus 3, it is mild to moderate. But if any child is in the range of 0 and minus 2 SD, it is normal. It's road to health. So if you look at this value, weight for height is below minus 1.7 ST. Okay, it is below minus 1.7 ST. It is not that danger. It is not a very severe condition here. It is not even, you can say it is the baby is fine. The baby, according to this being acute, it is not very obvious. This is not very underweight baby. This is not very acute malnutrition because the value is not very low. It's not below minus 2. It's not below minus 3. But if you look at weight for age, okay, this is below minus 3.2. That means the baby is underweight. But this underweight is why? Because he is suffering from stunting. His height for age is below minus 2 st. He is going towards stunting. Because of stunting, he is what? Underweight. So what is the ideal answer here? The ideal answer here is not acute on chronic. Acute to hai hi nahi guys. It is below minus 1.7. Below minus 1.7 is not a danger. So it is what? It is simply chronic due to chronic malnutrition or underweight. Due to chronic child is underweight. Did you understand? Due to chronic child is underweight. So you have to figure out from the values. There was a reason why they give you the values. If it was below minus 2 SDs, it would have been danger. Here it is minus 1.7. It's not that severe a condition. But it is definitely height for age is below minus 2.5. So that is going towards stunting chronic. Because of that chronic, the baby is also underweight. That's how you will explain weight for age below minus 3.2. Okay, if this value, if weight for height was also below minus 2.5, we would have said acute on chronic. Give me a thumbs up. Anybody who didn't get it, just write it. I will discuss it once I finish the session. We have another half an hour to go, a couple of more questions. So I'll discuss it again. Let's look at this one. Again, a PYQ, rotavirus vaccine, like I've told before also. They are fond to ask in exams about rotavirus. Which of the following statement about rotavirus vaccine is incorrect? Given orally, cannot be given after 6 months of age. Live vaccine, it has monovalent and pentavalent form. What is your answer over here? Given orally, yes. It is a live vaccine, yes. Cannot be given, it has monovalent and pentavalent, yes. Monovalent has just one variant, so that is Rotarix. That is Rotarix. Pentavalent has 5 variants, that is Rotatec. But in our government of India, now we use Rotavac, okay, Rotavac. This Rotavac, the new rotavirus vaccine, just for your revision, follows open vial policy. Even if you open it, the vial can be used up to 28 days, provided all the cold chain and that is used. Cannot be given after 6 months, you can give it till 1 year. At least first dose should be given till 1 year, okay. It can be, some of the books says 8 months, but we generally, according to NIS, we go till 1 year. Side effect of rotavirus, one of the another commonly asked questions, intersusception. Intersusception, okay. 5 drops is the dose. Here the variant is something else. How many it is active against, ठीक है. ठीक है निको, अब मैं लास्ट वाला फिर से करवा दूंगी. Alright, now look, another year they gave a question on, okay, rotavirus vaccine till 1 year, and one more I want you to remember, penta and rota can, because they are the most expected, penta, rota can be given till 1 year, can be given till 1 year. Penta and rota can be given till 1 year. Alright, next time they asked a classification of vaccine. Which of the following is not a polysaccharide vaccine? They asked you based on the classification of vaccines. Which of the following is not a polysaccharide vaccine? Hepatitis B, pneumococcal, meningococcal, HIV. Yes, Volcaire. Yeah, I will explain. Don't worry. I will definitely take that because I knew you could have confusion in that. Okay. So this is hepatitis B is a recombinant. So I'm not going to spend too much time in this. Just have a look at this. Most of the exams, NEET, PG, INICEtfmge, they ask about live and killed vaccines. Since it's INICET, they went one step ahead. Polysaccharide conjugate, they are all subunit vaccines. They are all examples of subunit vaccine. Polysaccharide, you have pneumococcal, meningococcal, HIV. Conjugate, where they are using the protein and the polysaccharide is mixed by a, comes together by a T cell. Pneumococcal, meningococcal, HIV. Also remember typhoid VI polysaccharide. Recombinant hepatitis B, they asked in INICET, how do you prepare hepatitis B vaccine? So we using hepatitis B surface antigen. Okay? Next time HPV, cervical cancer vaccine, is very soon going to be introduced in our NIS for 9 to 14 years old girls, and this is Cervavax. This is directed against L1 capsid major protein. Alright, Lyme's disease, cholera, toxin B. Just go through that. Okay, going to the next one. Patients following requiring immediate life-threatening care are characterized under which of the following triage? We never knew that triage will, we always know that triage definitely turns up. Now this is a question that could come in NEET PG, that could come in FMG exams, you don't have to worry about it. It could come in any exam. Yes, red. Immediate life-threatening is red. Now please remember, if I have the red color, you have to cater to within first 6 hours. And this is what? Highest high priority. Highest high. Never say highest is red, yellow is high. That is wrong. Highest or high is red. Immediate resuscitation, limb saving surgery. Resuscitation, limb saving surgeries. Immediate resuscitation, limb saving surgeries. Alright, is needed over here. Then you have yellow or blue. You can have blue or yellow, blue, or you could also have yellow over here, blue or yellow. Now this blue or yellow, guys, they require assistance first 24 hours. You can stabilize them, like suppose medium priority, like suppose they've suffered a fracture or something, you stabilize, they can wait for the surgery to happen. Next one over here in the line we all know is green. Okay, green is low priority, they are ambulatory. And the last one, which is black is the dead or moribund. They are the least priority. Suppose in the exam comes hemothorax, pneumothorax, which category are you going to put it into? Everybody in the comment section. Hemo, hemothorax का patient victim है, pneumothorax का victim है, किस category में डालोगे? Which category are you going to classify hemo and pneumothorax? Something which is expected. Yes, good. Hemo and pneumothorax, we are going to put them in which category? So we can put in red. Hemo and pneumothorax. ठीक है? All right. Okay, going to the next. So immediate life-threatening care. Don't go and mark black. नहीं, black तो dead है या likely to die. Alright? Okay, another disease which is expected again, diarrhea, tetanus, rabies, pneumonia, STD. One will comes in all the 3 exams, which is not seen in some dehydration. So I thought I will just revise the classification of dehydration. Treatment plan you can check out from pediatrics, treatment plan A, B and C, or you can also check up in my RR and PrepLadder app. I have discussed the treatment plans there, but classification abhi kar lete hain. So I'll just take you to, first I'm going to take you to classification. Look over here everybody. Degree of dehydration, mild, moderate, severe. Overall condition, mild mein the person definitely is well alert, the baby. Moderate, restless, thirsty, irritable, he wants pani. But severe, the buzzword is lethargic. Eyes, mild, normal, moderate, a little sunken, severe, very sunken. Sunken eyes you get in moderate, but very sunken is in severe. Dry eye, severe. Anterior fontanel, normal in mild. Moderate, it is depressed, very depressed, severe. Tears present in normal, both it is absent. Mouth plus tongue, moist. Mild में moist. Sticky. Dry कहाँ होता है? Severe. Eyes are dry, tongue is dry. Skin turgor slightly decreased in mild, moderate decreased 1 to 2. If you pinch, it will come back in 1 to 2 seconds. Very decreased, it's going to come back in more than 2 seconds. Next slide, let's revise. Thirst in mild is normal, moderate drinks eagerly, severe lethargic hai, unable to drink poorly. Pulse slightly increased, moderate, rapid but weak, severe you won't be able to palpate it. BP normal, decreased, severe again you can't record it. Respiratory rate slightly increased, moderate and severe again increased, deep and rapid. Urine output reduced in both this and this. Treatment plans, please revise it once again, but over here. So if I give you a question over here, what is the answer? Which is not seen in some dehydration? Sunken eyes, of course we saw sunken eyes. Very sunken is in severe. ठीक है, सम में संक आई संक हो जाते हैं. लिथार्जी नहीं है, लिथार्जी इज इन सीवियर. Thirst, yes, some dehydration is thirsty. Delayed skin pinch, yes. Decreased urine output, yes. Markedly decreased urine output is in severe, but urine output is decreased in some also. Done revision for this one. Can I go to the next question, guys? All right. What is the answer to this? A longitudinal observational and analytical study is known as classification of study designs. Longitudinal observational analytical study is known as longitudinal observational analytical. Now, what are the observational and analytical studies? It is case control, it is cohort, it is cross-sectional, it is ecological, it is cross-sectional, it is ecological. But here the question had a buzzword, longitudinal. That means it's a horizontal study design. Alright, and we are doing a follow-up. So which one becomes your answer over here? Cohort. Cross-sectional and ecological, what is at same point of time? Just a quick revision. Same point of time. In same point of time, guys, we can do a cross-sectional study also. We can also do a ecological study. But in a cross-sectional study, we rely on primary data. Primary data means I am going to collect the data myself. Ecologically, we rely on which data? Secondary data. I am going to rely on previously collected data. And ecologically, the unit of study is everybody, population. Okay? Okay. Another thing, look at this one. Match the following columns on epidemiology guidelines. This only for INICET. Guys, I would not say stress too much for NEET PG or this thing. Okay? But you can... Okay, what is the answer over here? Match the following columns on epidemiology guidelines. Only for INICET a topic dekh lo. Okay? Care. What is care? What is care, guys? Let's have a look at the table. Let's have a look at the table. Ek baar table revise kar lete hain. So this I have also given out in the LRR. This I have also given out in Preplada RR. Everywhere you will find this table, guys. Case report is care. Case report. Care report. Okay? RCT is for Consolidated Standards of RT, reporting trials. Observational studies, strengthening the reporting of observational studies in EPID. Observational studies, OB in EPID. This is STROBE. MOOS, meta-analysis, when we do a literature review of observational studies, meta-analysis. Systematic review and meta-analysis, both you can use PRISMA. Qualitative research, the word is here, QR. SQR, qualitative, qualitative. ठीक है? STARD is diagnostic accuracy. Two another words they use is Quorum and Cochrane. Quorum and Cochrane are guidelines for meta-analysis reporting. We have Cochrane guidelines. When you get down to do thesis, you will get these words. Okay? This table only for INICET, I would say. Okay? So if you have care, what are you going to mark? What was your answer? Some of you are writing B, some of you are writing A. Why? Some of you are writing B and A. Now consort is trials, care is this one. So A to B1, A to B1, we got the answer there itself. C, Prisma, systematic review. D, observational study. Only the reporting guidelines for this exam. Okay? Another commonly asked topics, which is whether INICET, NEET, FMG, all of them asked. So can you give me the answer to this? Water from a stagnant drain collected in a container and observed for breeding mosquitoes. The image of the larva, everybody is shown. What do you see over here? What do you see over here? You see a siphon tube or a breathing tube. This is longer. This is in size. Aedes and Culex both have the siphon tube. But over here, this is longest. This is what? Culex. Anopheles, everybody has no siphon tube. Anopheles, look over here. Let me show you this chart. If you look over here, Anopheles. Anopheles is resting parallel. Anopheles, no tube, no siphon tube. But if you talk about Culex and if you talk about Aedes, this is Anopheles, resting parallel to the water surface. Aedes has a shorter tube. Aedes has a shorter tube. If you talk about Culex, it has a longer tube. Okay, rest of the images we have done in NRR also. If you look over here, the eggs, Anopheles breathes in clean water, can fly up to 2 to 5 kilometers, enjoying a boat ride, everybody. So egg shaped, the eggs are how? Single boat shaped. The eggs are how, guys? Single boat shaped with lateral floats. Boat shaped with lateral floats. Now Aedes is because humans are letting it breed. Why? Because we leave artificial collection of water. So here also single, but they are kaise? Cigar shaped. Cigar shaped. And if you talk about Culex, nuisance, dirty water, flies up to 11 kilometer, laying its eggs in clusters. INICET had asked earlier when it was AIMS, it had asked 100 to 250 eggs per cluster. Okay? Per cluster. This is Mansonia, star shaped. This is Mansonia. The hairy wings over here is sandfly. Hairy wings over here is sandfly. This is Anopheles only. Boat shaped lateral floats. Now see, mosquitoes expect in NEET, expect in FMG, expect in INICET. INICET went one step ahead and asked the other entomology based question as well. See, spot the wrongly matched pair of arthropod and disease transmitted. So what is it? Housefly, polio, louse, epidemic typhus, itch mite, scabies, black flies, Chagas disease. What is the wrongly matched pair over here? So I want you to do this table as well. What is the wrongly matched pair over here? Good. Black fly is not Chagas disease. Chagas disease is which one, everybody? Chagas disease. So I'll take you to a table over here. Do go through this table whenever you have time. Sandfly, all the diseases are written. Leishmaniasis, fistral, Kala Azar, phlebotomous argentines. Housefly, CC fly, African sleeping sickness. Riduit disease, or like we call it as Chagas disease. Riduit bug, Riduit bug is American sleeping sickness or Chagas disease. Black fly is onchocerciasis, completely black in color. Louse, the mnemonic is PERT, pediculosis, epidemic typhus, relapsing fever, trench fever. Rat flea is the mnemonic is bench, bubonic plague, endemic typhus, shigerosis, hymenolepsis diminuta. ठीक है, trombiculid mite, scrub typhus. In this you have the eschar formation, the black wound, the black mark in the wound. Trombiculid mite, strawberry shaped, completely red in color. Since they ask this, they can ask you this. I'm quickly writing. This is louse, this is rat flea. What is this fly? It has a single wing. No, it has two wings that are overlapping. This is your CC fly. This is your CC fly. This one over here is your riduit bug, which is transmitting American sleeping sickness, okay, and or Chagas disease. This is black fly, river blindness, onchocerciasis. This is house fly. This is house fly. This one which has a chitinous covering, this is heart tick. The disease with heart tick is important, guys. All right, Lyme's disease, babesiosis, KFD, very important. KFD could come in your exam. This is a soft tick. Q fever, relapsing fever, but Q fever has no vector in humans. Important for NEET, PG, FMG, all exams. No vector in humans. No vector in humans. This one right here, guys, trombiculid mite, like I told you. But very important point. I'm going to zoom it. Trombiculid mite, if you look at the figure number 1, the image number 1, how many pair of legs can you spot over here? This has 4 pairs of legs. This has how many pairs of legs, everybody? It has 4 pairs of legs. This does not transmit scrub typhus. Look at this larva. Larva has 3 pairs of legs. The sugars that we call it as. 3 pairs of legs. This is transmitting scrub typhus. Very fond. INICET loves asking about scrub typhus, guys. Somehow eschar word will be there or something. And also one more thing, guys. Scrub typhus. What is the agent? So how have we learned the agent of scrub typhus? How have we learned the agent of scrub typhus? Orentia shushu. S-U-S-U scrub. Shushu. Shushu gamushi. Gamushi. Alright. Orentia shushu. Scrub typhus. Clear? Everybody? Chalo. Moving ahead, person walking on the street, levels of prevention, gets bit by a dog. The person is advised rabies vaccine and immunoglobulin, which level of prevention it is. So anybody, any form of vaccination, which level of prevention? Now, has the person suffered from rabies? Has the person suffered from rabies? No, please don't say secondary. Any form of vaccination is primary. Dog bite is a risk factor. I think INICET gave a question, guys, where the woman was suffering from elephantiasis, okay, elephantiasis, and there was a picture. I don't have that picture right now, but there was a picture of a woman who was suffering from elephantiasis, and her legs were dipped in water like this, okay. So this is tertiary. That was the question, which is tertiary, to prevent further damage. But here it's dog bite. So dog bite is a risk factor. Secondary is early diagnosis and management, like screening, health camps, all right, screening, health camps, annual health checkup, all these are secondary. Pap smear, breast self-examination, mammography, oral mouth examination, everything is what? Secondary. I will give you the PDF, don't worry. Let's move to this one. 2 doctors were asked to read and report x-rays. Kappa value obtained was 0.71. What is the correct interpretation based on the value? So just wanted to show you a couple of more questions, guys. We'll have the class another half an hour, I think. Till 12:30, I will wrap up the session for you. Okay, and then share the PDF pretty quick. Just give me some seconds, some 1 or 2 hours, I'll send the PDF, okay, because there are a couple of things that we write in the PDF so that you can benefit even more. So what is the correct interpretation? What is Kappa stats telling you? Good, good, and the answer is also good, guys. Okay, good. Chalo, what is this, guys? Kappa statistics. So let me straight away take you to this level of agreement between 2 observers. Basically, this checks about the reliability. Like suppose there is a woman who's suffering from anemia. I look at the conjunctiva and say, oh, she's anemic. There's another researcher who says, oh, she's anemic. Now both of us could agree on the same thing, maybe by chance. Both of us agreed to the same thing. I'm also saying she's anemic. The other one is also saying she's anemic due to chance. When 2 observers agree beyond chance, okay, so what does Cohen Kappa do? It checks for level of agreement between 2 observers beyond chance, not by chance but beyond chance. So in this, the value is calculated from 0 to 1. So they asked about 0.71. So this lies in good. Anything which is above 0.7 is good. Alright, next time they might end up giving you the calculation. They will write level of agreement observed 0.6, agreement expected by chance. They will give some value. They will ask calculate Cohen's Kappa. So it is agreement observed minus agreement expected by chance divided by 1 minus agreement expected by chance. No, it's not tough. See, this is the formula. NEET PG 25. Just get this formula. 2 people who agree beyond chance. So there will be an agreement that we actually observe and there will be an agreement that we expect by chance. Subtract them, divide by 1 minus that expected by chance. Okay? Since they have given Cohen's Kappa, this time they can give you this curve. What is the name of this curve? Just wanted to revise this quickly. What is the name of this? Yes, of course, Ritika, hopefully I will definitely take up. So we just have a couple of more questions, okay? We are on the 70th slide. We have to go till, we have 40 more slides to go. So I won't take too much of time. What is this? This is ROC curve, receiver operator curve, alright? Now in this, I want you to pay very good attention to the markings. What is on the x-axis? What is on the y-axis? This is done to decide the cutoff, which cutoff we should keep. It is meant for diagnostic performance. ROC curve helps us assess the diagnostic performance. So whenever we have 2 different cutoffs, we are going to plot an ROC curve. Software is going to do it for us. On the y-axis, you have true positive. True positive means what? It means sensitivity. On the y-axis, you have false positive, which you could also write as 1 minus specificity. Then we plot the lines. Now, whichever curve has more area, that you're going to select. So over here, blue line has more area under the curve. So you can just read this with me once. These are the ROC values. More area under the curve, more area under the curve, more area under the curve, better the cutoff. More area under the curve, better the cutoff. And what gives you the area under the curve? There is something known as Uden's index, only for INICET. Formula is sensitivity plus specificity minus 1. Higher the Uden's index, better the test for a particular condition. For this also, the value of ROC curve is plotted between 0 0 to 1 guys, and if it is like 0.7 to 0.8, it is good. If it is more than 0.7, we accept that curve. You can accept that curve. Since they gave you Cohen's kappa, you have a chance of Uden's index coming up. Okay? More the area under the curve, better the cutoff. How will you calculate the area under the curve? You just have to look at Uden's index. Value more than 0.7 is acceptable. Thumbs up everyone. Can I go to the next image? One more image which is again a favorite of INICET, Kaplan-Meier. So you must know Kaplan-Meier tells us about the survival analysis. Kaplan-Meier tells us about the survival analysis. Kaplan-Meier tells us about the survival analysis. Like suppose somebody got diagnosed, somebody took a screening test for cervical cancer. Now how many years she is going to live compared to if she had not taken it, how many years she lived. Okay, so it tells us about the how many years she is going to live after the screening test. 5 years survival. And you know, they had given a question where they had made 2 markings. How do you select the line where you have done a screening test? The line which is going towards more time. This is time. Okay, so the line which is going towards more years. Blue, the person is surviving 35 years after this thing. In green, it's only up to 25 years. So which one is telling you a better survival chance for whom? For group 1. So just look at the line. If it is more towards, which of the line is more towards the x-axis? In very simple terms, I am telling you to how to select Kaplan-Meier graph. Okay, whichever line is more going towards the x-axis, go for that, because that is telling us more survival rate. Okay? Since it is INICET, Kaplan-Meier, ROC, kappa stats. One or the other you can expect in the exam. Okay? Next one, we can't forget VVM. So just read one by one each of the statement and quickly tell me. VVM has a chemical indicator in the circle which changes color. True or false? True or false? Where does the VVM have a chemical indicator? Does it have in the circle or does it have in the square? Is it true or false? Everybody, I want the answer. So VVM doesn't have, it is outer circle, inner square. Dunya gol hai. The world is round and all of us are trapped inside it. So VVM has a chemical, this is false. VVM has a chemical in the square. It is toluene sulfate. It is in the square. VVM gives an idea for number of days for expiry of the vaccine. Is it giving you an idea about expiry? No. Even if the vaccine has expired, even if the VVM is intact and the but vaccine has expired, please don't use it. It is the only tool among all time temperature indicators that is available at any time in the process of distribution and at a time vaccine is administered at health center. True. Yes, it indicates whether the vaccine has been exposed to a combination of excessive heat. Yes, it tells us the heat damage. VVM tells about efficacy of the vaccine. No, not directly. False, not directly. It tells us about factors that affect efficacy. It's telling indirectly factors. It reflects on factors that efficacy. It reflects on factors that affect efficacy. It reflects on factors that affect efficacy. Expiry date of the vaccine can be relaxed if the VVM is intact. Never, ever. It has nothing to do with it. Never directly telling us on efficacy or potency, but it tells us on the factors that affect it. Then you can see these images. Which one are you going to use? This one and this one. When the outer circle, when the inner square, always compare IS to OS. Inner square lighter than outer circle, use. Inner square starts to change color but still lighter than outer circle, use. Same color, discard. Darker, discard. Where are you going to discard it? Not in blue bags. This will be discarded in yellow bags. Why? Because they have vaccines in them. So they are now biotechnology waste. If the question in your exams comes, guys, vaccine vial, discarded in which bag? Or they give you broken vaccine vial, discarded in which bag? What is your answer? It is blue. But question like this, because it's a glass vial, expired vial, has vaccine in it, something that has vaccine in it, okay, has vaccine left, it is going to go into which bag? Yellow. Never say broken goes into white. Vaccine vial glassware goes into blue. Chale aage. I hope you're understanding, guys. Couple of more questions to go. Tell me this one again. All of these are PYQs, so don't worry that you're covering PYQs only. It's just a quick revision of PSM. Post-earthquake, some buildings were destroyed and building codes were changed to make more earthquake-resistant buildings. This is known as, what is this known as from disaster cycle? What is this method known as? This method is known as mitigation. Mitigation is done before disaster strikes. Alright, before disaster strikes. And this is done to prevent hazard from becoming a disaster. Prevent hazard from becoming disaster. Prevent hazard from becoming disaster. Prevent hazard from becoming disaster. Like make the buildings earthquake resistant. If they are not, even a small earthquake can make them fall. Make the dams flood resistant. So that is mitigation. Okay. Another question, let's see. Color produced in OT test after 5 minutes is due to action of. Color produced in OT test after 5 minutes is due to action of. Now what is OT and OTA tests doing? Orthotoluidine test and orthotoluidine arsenite test. All of these are detecting what? All of these are detecting free or residual chlorine. So if you have to detect free chlorine, to test free chlorine, you have to see the yellow color in the first 5 to 10 seconds. Okay, after that the yellow color is due to both free and combined chlorine. All right. So whether you have OT reagent or you have orthotoluidine arsenite reagent, the yellow color which is after 5 to 10 seconds is due to both. Now just look at this golden points. Tell me true or false for each of this statement. Okay, tell me true or false. First one, OTA test better than OT test. Quick answers. It should be on your tip. The first statement. OTA test better than OT test. True or false? OTA test better than OT test. True or false? Very good. True. Next, yellow color change within 10 to 15 seconds is due to free chlorine. True or false? Yellow color change within first 10 to 15 seconds is due to free chlorine. It is true. Okay. OTA test detects both free and combined chlorine separately. Absolutely true. It detects both free and combined chlorine separately. Absolutely true. OT test detects free chlorine separately. True. OT test can detect combined chlorine. If somebody asks you, can OT test detect combined chlorine? Yes, of course. True. But how will it detect it? Not separately. It detects it but not separately. How does it detect it, guys? It detects it total minus free. It does not detect it separately. It can detect it from total minus free. Okay? Alright? Okay. Moving to the next one, another PYQ. Can you answer this? Numerator of in perinatal mortality is. Numerator in perinatal mortality. What is perinatal mortality? It was an indicator which is telling us about the care which is being given when the woman is pregnant as well as when the woman has delivered. Combined obstetrics and pediatrics care. What is your answer? Have you given the answer? Why haven't you given the answer? Post-neonate death with weight 2.5 kg, early neonatal death with weight 1000 gram, abortion less than 5 grams, stillbirth fetus more than 500 grams. Now see guys, PMR is death beyond or death, like when will you call it? Death, when will you include it under perinatal? Death within 28 weeks gestation. Okay, if the baby dies in 28 weeks gestation plus death first 7 days of life. Alright, everywhere 1000 live births. Okay, live births. Now over here guys, remember in certain countries we also take it as total births. Now 28 weeks gestation, this is fitting into the criteria of stillbirth. Now when do you call a baby as stillborn? You can calculate the child, the death as a stillborn if the baby is dead in the fetus beyond 28 weeks gestation. If the baby dies at 28 weeks, 29 weeks, you will call as stillborn. Or if the weight, that means 28 weeks is 7 months, so weight is at least 1 kg. Or the length to call it as a stillborn, the length to call it as a stillborn is how much? 35 centimeter. So here which one fits? Post neonate death with weight, no. 2.5 is not the criteria. Abortion less than 500 gram fetus, no. It has to be 1 kg. Stillbirth of fetus more than 500 grams, no. Early neonatal death with weight, how much everybody? 1000 grams. 1000 grams or 1 kg. Am I clear everybody? That is perinatal. Just let's quickly revise maternal mortality ratio ka formula. Guys, what is the formula for maternal mortality ratio? Something that you can expect in exams. Maternal mortality is the only formula where multiplier is 1 lakh, numerator is not a part of denominator. So it is total maternal deaths per 1 lakh live births. In rate, if it is MMR rate, it is woman in per 1 lakh, woman in reproductive age group. Never include accidental incidental deaths, like the woman slips in the washroom and dies, falls from a stair, suffers from electric shock. That is not included. Accidental incidental death not included. Accidental incidental death, okay? Accidental incidental death not included. It is only due to and only due to the deaths related to pregnancy or up to 6 weeks postpartum. 6 weeks postpartum. Alright? Chalo. Come to the next question. This is a PYQ from your exams from INICET. Which of the following health management technique is based on behavioral sciences? NEET, PG and FMG exams, guys, they like to ask about quantitative techniques. This one asked qualitative techniques, and I have also given you a way to remember it. Very good management by objectives. There is a mnemonic, guys, if you remember, for behavioral sciences. Pokemon. What is the P? Personal management. Okay, personnel management. P say personal management. O say organizational design. C say communication. I say information system. And what is MON? Management by objectives. Alright, Pokemon. Remember that? Pokemon. The quantitative techniques are all of these, guys. These have been discussed before also. You can check them out. For you will remember cost-effective analysis, non-monetary terms. The outcome is assessed in non-monetary terms. Cost-benefit, it is monetary terms. Work sampling, record activities of health workers. Recording activities of health workers. Okay? Go to the hospital and see where they are spending time. Network analysis can come. PERT and CPM. This I have discussed in LRR also. Critical path method is the path of longest duration. Okay, so you can check that out. Alright, couple of more questions to go. Tell me the answer to this. Which of the following statement is true? PPV increases with increasing prevalence. Sensitivity, this is a favorite PYQ. NEET, PG, INICET, FMG exams, all of them ask about this question. So can you quickly tell me the answer to this? PPV increases with prevalence. Sensitivity depends on prevalence. Specificity depends on prevalence. In low prevalence, positive of a highly sensitive test means true positive. Very good. This one, just wanted to revise one equation. PPV is directly proportional to prevalence, everybody. NPV is indirectly proportional to prevalence. Sensitivity and specificity of a test independent of prevalence. They do not depend on prevalence. Whatever be the prevalence, sensitivity and specificity is going to be the same. And in low prevalence, if a sensitive test is positive, that means it is true positive? No. In a high prevalence, suppose the prevalence, like suppose I do RBS, alright, I do RBS among elderly who are beyond 60 years. Now in this, the burden of diabetes is more. The prevalence of diabetes would be more. So I would be able to filter out more people who are actually suffering from diabetes. That means if my test comes positive, okay, if my screening test comes positive, there are high chance of person suffering from disease. high chance of actually having disease. High chance of having disease. Why? Because the prevalence is more. Why? Because the burden, the prevalence is more. But if on the other hand, if I do an RBS on say everybody who's beyond 30 years, then what happens? The prevalence is less, the burden is less. So even if my screening test comes out to be positive, the chance of actually having people positive would be less. PPV would be less. Why? Because the prevalence is low. So I would not be able to filter out many people who are actually suffering from the disease. Did you understand this, guys? That is why high risk screening is also known as selective screening. That is the most efficient screening. If the screening test comes positive in a high risk group, we have more chance of getting people who are actually suffering from the disease. High risk screening means the prevalence or the burden is more. Okay, for your exam, you will remember this equation: PPV directly proportional to prevalence, NPV indirectly proportional to prevalence. Can we go ahead, everybody? All right, what is the answer to this? Give me a thumbs up if you got that question. Okay, all right. If the hemoccult test is negative for screening of colon cancer, no further test is done. If the hemoccult test is positive, the individual will have a second stool sample tested with the hemoccult 2 test. If the second test for blood is positive, the individual will be referred for more extensive evaluation. What is the effect of net sensitivity and specificity over here? What is the answer? Now you can see you do a first test. Those who are positive, in them you will do a second test. So what is this? This is nothing but test in series. Now how have I taught you? This is series and this is parallel. What are you doing in parallel, everybody? Parallel, both together. Both tests together. Okay? Both tests together. Parallel testing, we also call it as simultaneous testing. We also call it as simultaneous testing. What is series? One after the other. So this is what? Sequential testing. This is what? Sequential testing. One after the other. Okay. Now here you have written sensitivity and here you have written specificity. Here you have written specificity. Now what happens in series? Just remember like this, one after the other. So you will be able to filter out less people. So what happens in sensitivity? In series, the sensitivity decreases. Specificity increases. In parallel, both the tests are together. So you will be filtered out more number of people. Sensitivity increases, specificity decreases. Alright. So just remember it that way. So your correct answer was option B. Option B, right? Net sensitivity decreased and specificity increased. Guys, I'll just come one moment. Can you do this? Match the following, everybody. Okay, just do this one. I am coming in just a while. Can I answer, guys? Have you written, everybody? Okay. So expired medicines, we all know yellow. Okay. Antibiotic. What have you written? Why can't I see your questions? 1 second, everybody. Okay, now I can see. Alright, 1B. Most of you have written 1B. So, 1 kya hai? Expired. Okay. Catheters. Now, where do catheters go, guys? Where do catheters or any tubes or any kind of these things go? To A. Good. Discarded lab report form. Now, what is discarded lab report? It's just a general way. So, this is going to go where? Black. Alright. Now, so what did you write for 3? What did you write for 3? 3E. Yes, good. And if I talk about antibiotic bottle, so antibiotic bottle again is going to go into blue. It's a glass bottle. It's going to go into blue. So do remember these things. That is very, very important. It can come in your exams. Which one, what goes? Wrapper of a Foley's catheter is going to go into a black bag. So those are all general based. Okay, now one more patent MCQ, just a couple of biostat questions. I'm going to give you one or two more questions, guys. Then we will wrap it up in 10 minutes and then be ready with your doubts. What is the answer to this question? There is a new drug, all right? There is a new drug which is designed to, one second. Yeah, there is a new drug which is designed to lower the Okay, there is a new drug which has been designed to lower the cholesterol level, is being tested on 1,000 participants. The null hypothesis is that the new drug does not affect cholesterol level. After analyzing, just think and mark, no rush. After analyzing, guys, the researchers have concluded that after analyzing the data, the researchers concluded that the drug doesn't work, but in reality it does have a small but clinically significant effect. What type of error has occurred? Very good, very good. So what is happening over here? What does the null hypothesis say? Now everyone listen to me, focus on me once, let me explain you this. What does the null hypothesis say? H0 always says that there is no difference, right? There is no difference in the treatment of a disease between the two drugs. What does HA says? HA says new drug is better. New drug is better. Now over here, the null hypothesis is that the new drug does not affect cholesterol level. But after analyzing the data, the researchers have concluded that the drug doesn't work. Alright, what have the people shown in the clinical trial? In clinical trial, people showed drug not better. People showed drug not better. Alright, drug not better. Drug is not better. That means they showed null hypothesis is true. But in reality, it does have a small but clinical significant difference. In reality, the drug is better. In reality, the drug is better. But we could not show that. And what did we do? We ended up accepting a false null hypothesis. So this is an example of what? Type 2 error. Just read over here. Once we analyze the data, in the clinical trial, I showed that the drug doesn't work. But in reality, the drug does work. So that means in reality, H0 is false. In reality, the H0 is false. But what we have done, we were not able to show it. So H0 false but accepted. What is that error, everybody? Type 2. How do you remember type 1, type 2 errors? Type 1 is with the word true. Null hypothesis true but rejected. Type 2 you will remember with the word false. Null hypothesis false but accepted. Type 1 error is a false positive trial. Type 2 error is a false negative trial. Which one is more serious? Obviously type 1 error. Good. And what is the value of type 1 error that you can allow in your study design, guys? It is given by p-value less than 0.05 means statistically significant. Just remember this, statistically significant. P-value is the probability of committing a type 1 error, which means statistically significant, which means it favors alternate hypothesis. It favors alternate hypothesis. That means the new drug is good. If I get a p-value of 0.02 in my research paper, what does this mean? It means result is significant. And what do you mean by significant result? It means that I am rejecting. P-value is the chance of committing, probability of committing a type 1 error. Okay, probability of committing which error? Probability of committing a type 1 error. तो अगर मैंने बोला कि p-value 0.02 है, that means I am committing a type 1 error only 2 times out of 100, which could be by chance. Rest of 98 time it favors alternate hypothesis. That means the new drug is good, and that is what we are showing. Will you remember these 2 points for your exams, guys? P-value, if anywhere you see less than 0, not even equal to, less than 0.05 means it is significant, which means the new drug is good, and that is what we are showing. Clear? Chalo. Anyone who didn't get it, you can ask me. I will repeat for you once again. Alright, tell me the answer to this. Test of statistical significant, highly expected in your INICET, even in NEET PG, even in FMG exams, because it has already come in all the 3 exams. Study is done on a group of children to check variation of SIDS in summer season from June to July, and from August to September in another group with similar characteristics from same area. Which test should we use? Think guys, think. There is a simple approach I have always told you. Everybody think before you mark. Think about the approach. What is the approach? I have told you one basic things. If you look at the videos, you have to first figure out, are you talking about quantitative variable? Are you talking about qualitative variable? Now over here, which variable are you talking about? Quantitative or qualitative? And how do you differentiate? Quantitative variables are measurable. What do you mean by measurable? They have a unit. Qualitative variables are non-measurable. Non-measurable means they don't have a unit. No unit. They don't have a unit. You can't measure them. You can count them. Qualitative are what? Countable. You can count the number of women with breast cancer. You can't measure breast cancer, but you can measure height, weight, BP. They have a unit. You can count the people with hypertension. You can't measure hypertension. So if you look over here, we wanted to check SIDS from June to July, August to September. How many groups? You are clear that here you have 2 groups. But are you talking about quantitative or qualitative variable? SIDS. Can you measure SIDS? Can you measure how many children you can count how many children suffered from SIDS? SIDS is any disease is qualitative. This is a qualitative variable. Now T and ANOVA, these are quantitative. Wilcoxon rank or chi-square test. Now presence or absence of disease is not an order. So I will go 2 groups. Which one I will use? Chi-square test. Please don't be in a rush. Just try to see, are you talking about quantitative or qualitative variables? If you are talking about quantitative variable, you will use a non-parametric. Quantitative, you will use a parametric. How do you figure out quantitative? Like suppose I had said hemoglobin in a group of alcoholics before and after treatment. What would you use? Hemoglobin in a group of alcoholics before and after treatment. What will you do? Before and after treatment. Hemoglobin in a group of alcoholics before and after treatment. What do you want to do, guys? Now hemoglobin is quantitative or qualitative? Hemoglobin you can measure. It has a unit. So it is quantitative. And you're doing in one group, in a single group, before an intervention, after an intervention. So I will use a paired t-test. For your exams, remember quantitative data are TAP. Paired t-test is for single group, one group. Unpaired t-test is for 2 groups. And ANOVA is always for more than 2 groups. And rest of all the tests on the non-parametric side, they have all fancy names. These you are going to use for 1 group. These you will use for 2 groups. In them mostly you get chi-square. And these fancy names are used for more than 2 groups. Okay? Just a quick revision. Just ask yourself quantitative variable, qualitative. If quantitative, you will use a t-test, you use parametric, then see 1 group, 2 group, more than 2. If it is qualitative, like here it was SIDS, you can't measure SIDS. You can count the children with SIDS. Okay? Alright, one more image that could come in your exam. Quickly tell me what is the name of this image, guys. The name of this image is, what is the name of this image? So the name of this image is box and whisker plot. The name of this image is box and whisker plot. What has happened over here? You have to look at, you have to rotate rotate clockwise. You have to rotate it clockwise. Now you have to look at rotate it clockwise, and then you have to look at the distribution. If you rotate this one clockwise, it is equally distributed on the, these are what? Quartiles, okay? These are what? You have a box and whisker like this, Q1, Q2, Q3. These are quartiles. So equal distribution on either side. So what is this, guys? Normal. If you look at graph number 2, image number 2, you rotate it. Where is the gap coming more? Where is the gap coming more? It is coming more on which side, guys? Left side. So what is this? Gap is more on the left side. Left sided skewness. If you look at the third graph, okay, this is what? Here it is right sided skewness. Here it is right sided skewness, positive skew. Just look at the gap on rotating, which side it is more. Also look at the tails. The tail is elongated on which side? If suppose it's both sides it is equal, but the tail is elongated on the right side, then it will become right sided skewness. Alright, otherwise it will be normal. Okay, always rotate clockwise and look at the distribution of outliers. Okay, alright, one more image. Can you tell me what is the name of this image? This image is scatter diagram. Can you just do this? Okay, what is the answer to this image? What is this image, guys? This image is scatter diagram. What does scatter diagram represent? It represents what is known as correlation coefficient. Correlation coefficient. Now, uska value R deta hai. R ranges from -1 to 0 to +1. Now, if it is +1, that means it is something like this, and all the dots, okay, all the dots will be over here on this line. R is +1, perfectly positive. If you look at this, and if you see that all the dots are on this is what? -1, perfectly negative. But if you look like a graph like this is what? R is equal to 0, no association. Here, if you draw it something, if you draw a graph like this, it is alright, it is like, just for your reference, okay, if you draw it like this, it is almost going to become horizontal. So it is a weak positive relationship. If R is more than equal to 0.7, it is strong positive. If R is 0.4 to 0.6, it is moderate positive. And if R is less than 0.4 everybody, it is weak positive. So here it looks like it's almost weak positive. So I can't have this. I can't have -1.5 plus 0.5 plus 1.5 because they can't take such a high value. Okay, now here it is not almost straight. It is going to become straight. So instead of plus 0.10, I will go for plus 0.25. If it was, if it was something like this, I would have gone for plus 0.10. Clear? That is scatter diagram. Okay, give me the answer to this. We all know bicynosis, textile, bagasosis, sugarcane, silicosis, lower limb, asbestos, silicosis, silicosis, sandstone industry, asbestosis, B for basal, lower lobe, bicynosis, textile industry. You can match it. Do remember bagasosis is non-notifiable, asbestosis, cement industry, then you have silicosis, pottery, ceramic, construction work, silicosis, snowstorm appearance, nodular fibrosis, asbestosis, diffuse fibrosis. Okay. Alright, what's your answer to this? The disease transmitted by the vector shown in the image is endemic in Jharkhand. Which insecticide is preferred to control? So what is the answer to this one, everyone? What is the answer over here? Alright, what is this? Good. So over here, this is pyrethroids. Okay, this is Kala-azar or visceral leishmaniasis. So we are going to use pyrethroids. RK39 is the diagnostic kit that we use for filariasis. Okay, one more question that came in your exams. Which of the following is not included in sentinel surveillance? That is a very favorite question. Remember, STD clinic attendees are not a part of sentinel surveillance. The frequency of sentinel surveillance is biennial. It is done once every 2 years. Once every 2 years. It is done once every 2 years. Okay, one more question that I'm going to do is, because there is an update regarding this, lymphatic filariasis. WHO recommends dual therapy with albendazole ivermectin. No, it recommends triple therapy now. It recommends triple therapy. That means we use DC, albendazole plus ivermectin. And the target which was set to eliminate filariasis is not 2025. It is now 2027. Considered eliminated when number of microfilaria is less than 5%, no, less than 1%. This is correct. Children eliminated when children, considered eliminated when children born after the initiation of the program are free from anti-genemia. Okay, so that's an update over here. Even Kala-azar we would want to eliminate by 2027. Okay, alright. TB, what is the, okay, one second, tell me this one, then I will tell you the update in TB. The given image of a drug packet, so this you can see, there is a kink over here, that those are monthly doses, these are daily doses. So where do you have this? Leprosy, we now have 3 drug regime. We now have 3 drug regime for PBL as well as multibacillary leprosy. Duration PBL 6 to 9 months, multibacillary 12 to 18 months. Okay? And just go through these slides, guys. They have all the drug dosage as well. Later on in the PDF you can find these dosages. Now one more update, guys, if you remember, Nikshay Poshan Yojana. Nikshay Poshan Yojana is how many, what is the nutritional incentive now? ₹1000 per month. And one more update, MDR TB ka treatment regimen duration is 6 months now. From the pharma you will check out the dosage: bedaquiline, pretominid, linezolid, moxifloxacin. Alright, so this you should remember, 6 months duration. STD kits, one more question, how many kits do we have now? So we now have 8 kits. First kit is a grey color, but in grey color anorectal discharge is no longer there, okay, and a uniform color cefixime azithromycin. Second kit, ladies first, green color, vaginitis, secnidazole, fluconazole. Third color, non-herpetic ulcers. Alright, white color, good. Why? Penicillin acts. Fourth kit, a little problem, non-herpetic but a little problem, penicillin will not act. B, blue color, doxycycline. Kit number 5, danger, red, herpes. So, acyclovir. Sixth kit, now no ulcers, pain, lower abdominal pain, yellow color. Kit 6, again cefixime, all those will act. And kit 7 is black color, bubo. But we've added now a kit 8. What is that kit, guys? Anorectal discharge. Anorectal discharge. Kit 8 is anorectal discharge. Again, cefixime and cefixime and all these can act. So what did you do? Did you do match the following here? Good. See, remember kit number 8 is also there. Okay, what is steps approach? We do a surveillance of, is it for treatment, is it for mortality? What are you going to answer over here? Steps approach, what are you going to answer over here? Is it for treatment? Is it for mortality? What is it for everybody's? Oh, so sorry, this I had to show you at the end. We are just at the end, guys. So tell me the answer to this. It's a surveillance of risk factors for NCDs. Never say no. It's not for treatment. It's not for mortality. We do again. Look at it carefully, guys. It's not for treatment. It's not for mortality. It is a surveillance of risk factors for NCDs. This one is the steps approach. First step, questionnaire, lifestyle, behavioral factors. Second step, anthropometry. Third step, lab test. We have done it many times. You can go through the LRR PDF also. This is tracking phenomenon. Hypotensives remain hypotensive. If hypotensive in childhood, will remain hypotensive in adulthood. If hypertensive in childhood, will remain hypotensive in adulthood. And this one is your rule of halves. I want you to notice all these labeling. Outer one is the whole community. This is hypertensive subjects. This is diagnosed hypertensive, diagnosed and treated. And the inner one is adequately treated. Okay? Okay, another favorite question, guys, is an image of the viruses. So we are at the end, 5 more minutes. So can you tell me the this antigenic shift and drift, which one is showing? So the first one is bullet shaped rabies virus. GP41 you can identify by HIV virus. ठीक है, this one is HIV, this one is rabies. RNA DNA, do that classification from micro. This one is very good. This one over here is influenza, antigenic shift and drift. This one is, which one is this? Ebola. All right, so antigenic shift and drift, you should remember, this is a favorite question of INI. Drift means from the first, I sit in the first bench, from the middle seat I go to the corner seat, that is drift. Point mutation, epidemics. What is shift? I sit in the first bench, but now I have become a last bencher, that is shift. Results in pandemic, comes out with a newer variety. Okay, this is antigenic shift and drift. Drift is a minor change, small mutation within the same this, epidemics. Subtype, new subtype, that is pandemic. Okay, last question, guys. What is this image? The question is not very clear, just wanted to do this image ka question. Natural history of disease, what are the points? Okay, how a disease evolves or progresses without any interventions. So what is this image? Natural history. Let us discuss this once. So straight away come to the explanation. Stage of susceptibility, when we are exposed to risk factors. Exposed to risk factors. So over here what happens? Primary prevention. Don't let agent enter your body. But if your agent enters, exposure, immediately I won't get signs and symptoms, pathogenic changes, subclinical disease. We'll try to identify, make an early diagnosis. Then symptoms come. Usual time of diagnosis. Okay, after symptom, usual time. Stage of clinical disease. Over here we can apply secondary and tertiary level of prevention. If the disease has progressed, prevent further damage. And here what it is outcome. Outcome, whether the person recovers, disabled or death. This is natural history of disease. Okay, this image has come. Lead time, more important for NEET PG FMG. This image, natural history of disease, this is more important for INICET. ठीक है, natural history of disease more important for INICET. So that sums up, guys. In the PDF, you're going to find a table of various incubation periods of diseases, which you can go through, because they have asked, if you look at your PYQs, some commons: influenza, measles, chickenpox, rubella, mumps. Some common ones I have given you in the PDF. You can go through them. All right. Staph poisoning, you can remember. Clostridium perfringens, food poisoning, you can remember. Typhoid is very commonly asked, 10 to 14 days. That you can remember. Period of isolation. Isolation is done for the period of communicability. So couple of diseases they ask: measles, chickenpox, they have already asked. Influenza, they have already asked. Diphtheria, they have already asked. All right, period of isolation of these diseases. Period of communicability, they have asked of chickenpox, measles. So I'm just going to tick that for you. And one they have asked for diphtheria. Alright, so that was a quick revision or short for INICET. I hope you enjoyed this session, everybody. Anyone has any issues, you can just quickly drop in the comment section, guys. We will discuss it. You can just drop in the comment section. We will discuss it. So you can just let me know if you have any question. See, Srivastava also utna important I wouldn't say for INICET. They have not been repeated for quite some time now. For FMG and NEET PG, we will have sessions. Don't worry, as NEET PG approaches, we will have last 10 days short NEET PG. Then when FMG approaches, we will have short FMG as well. So you don't have to absolutely worry about it. Okay. IMR, MMR, the latest values. So I will just sum it up for you. The latest values of, IMR and MMR. Let me just sum it up for you. The latest values for IMR, MMR for you. Okay, now just a session. Just a second. That I have also put out on Instagram. So I am just going to take that slide and show you, because they are just the latest values, guys. So yeah. Okay, so as we know now, just let me write it somewhere for you. ठीक है, the latest MMR, these are not that important, so I'm going to add a slide over here. Okay, so let me write it for you. The crude birth rate, all right, crude birth rate now is not 19.5, 19.3 per thousand mid-year population. Crude death rate is 7.5, not 6 any longer per thousand mid-year population. Maternal mortality ratio 93 per lakh live births. Infant mortality rate, you can remember, 27 per thousand live births, and AGR, the annual growth rate of our country, is 1.18. These are the latest values which have been released by SRS, guys, so you can go through that. Okay, all right, so that is an important question. ILR, you will go for it, Amarjeet. MPH again, epid, biostats, programs are more important screening. कैलकुलेशन के लिए पॉइजन्स और ये सब तो करा दिया, पॉइजन्स कप्पा ये सब हो गया. कैलकुलेशन, जस्ट फोकस ऑन कैलकुलेशन फॉर INICET. MMR calculation can come, IMR calculation can come, screening calculations can come, AR calculation can come. I don't think they're going to give you likelihood ratio. I don't think personally they should give you that. Other than that, standard error calculations can come, confidence interval calculation can come in your exams. So I have a PPT which I have done on my YouTube for numericals. It was done when FMG exam was approaching, but you can refer for that for INICET also. ठीक है, malnutrition वाला question. डेप्थ मतलब कौन सी चीज़ का डेप्थ, रितिका? आई थिंक दिस इज़ लाइक वेरी वेरी बेसिक थिंग दैट, मतलब इतना हमें करना है. ओके, INICET क्वेश्चन, आई कांट फाइंड इट, 1 second. Where was INICET question? You need something, you don't find that. Yeah, every time it happens. Okay, I remember the INICET. I'll just tell you, I can't find the question, I can't see where the question has gone, but I can tell you about that question. See, in the INICET question, it mentioned, guys, that the weight for age was below -3.2. Okay, height for age was below -2.7 something or 2.5, and weight for height was below -1.7. Now, to call it as severe, it should be below -3, mild to moderate below -2. So here it is just -1.7. It is not a problem. So it is not acute, it is chronic because it is below -2. It is underweight. Now that underweight is because of chronic. ठीक है, it is not acute because it is within the range. Alright, so you don't have to worry about acute over here. It is stunting, on that it has been superimposed. Underweight has been superimposed. Alright. Anna, I will be doing a new session for FMG exams. If you want to revise, you can, but every time I do take out short, the latest short, so of course I will do that once FMG comes. ठीक है? Yes, you can do for MPH. Micro PSM, of course, we just did a micro PSM integrated question. The virus, influenza, shift and drift. उसमें पूछ लेंगे DNA, RNA बता दो, so that becomes a integrated. Alright, so that's it for today. Thank you so much. Have a good day. I'll share the PDF on Telegram group. We are continuously having quizzes on Telegram. Do attend that. And God bless you all. Please don't stop revising and don't stop studying. It's just a couple of days. It's not the end. It's not it's going to be the same throughout. So enjoy and keep just enjoy the process. That's all I can say. Okay, bye-bye. See you soon. All the very best for your exams.